Your palms are sweating profusely. Your face is as flushed as the Queen of Hearts. You can't hear anything but the chatter inside your mind. Your heart feels like it could jump right out of your chest and onto the floor in front of you. Your throat feels like it's drier than the Mojave Desert. You're like a fish out of water that can't catch its breath, and all you want to do is hide. You're having an anxiety attack. Everyone encounters a little bit of anxiety in different situations, for example, giving a speech. But people that are diagnosed with an anxiety disorder encounter high levels of anxiety in most situations on a day to day basis. Anxiety disorders are becoming more and more common, which is why I would like to talk and inform you about them today. First, I will be explaining what exactly anxiety is, what the symptoms are, and how it feels. Second, I will explain the different types of anxiety disorders, and finally, how to cope and treat these different anxiety disorders. According to the Merriam Webster Medical Dictionary website, the definition of anxiety is an abnormal and overwhelming sense of apprehension and fear, often marked by physiological signs such as sweating, tension, and increased pulse, by doubt concerning the reality and nature of the threat, and by self doubt about one's capacity to cope with it. In other words, the uneasy and fearful feeling of doubt about the reality of a situation, um, and whether or not that person feels like they can handle that situation. As I stated before, some of the symptoms are tension, increased pulse, and sweating, but according to WebMD.com, there are several other symptoms to look for. Other symptoms include shortness of breath, nausea, dizziness, dry mouth, and the feeling of being restless. Now that you are aware of what anxiety is and how it feels, I'd like to talk about the different types of anxiety disorders. There is not just one type of anxiety disorder, there is actually five. The most common is the generalized anxiety disorder that is described usually as an intense, overwhelming, and worrisome feeling along with the tension that lasts for months. According to the Brain and Behavior Research Foundation's website, there are approximately 6.8 million Americans, or 3.1% of the population, that is affected by generalized anxiety. It also affects twice as many women as it does men. Another common type of anxiety disorder is called a phobia. Phobias are usually irrational thoughts about a certain object or place that frightens a person. A few common phobias are arachnophobia, which is the fear of spiders, claustrophobia, which is the fear of small spaces, and glossophobia, which is the fear of public speaking. The third type of anxiety disorder is called obsessive compulsive disorder, or OCD. People with OCD usually begin repeating tasks or rituals. These rituals are usually done to prevent a fearful thought that they have from becoming true. For example, someone might wash their hands 5 times in a row because they think that it will help prevent their loved ones from getting ill. The next type of anxiety disorder is called panic disorder. According to the Brain and Behavior website that I had mentioned earlier, panic disorder can occur at any time of the day, including while they are sleeping, and is characterized by sudden attacks of terror accompanied by the physical symptoms. The final type of anxiety disorder occurs because of or during social settings. This type of disorder is called a social anxiety disorder, and this disorder is also fairly common and is characterized by extreme self consciousness about what others are thinking about you during a social situation. You now know the different types of anxiety disorders and how they affect people. So let's find out how we can deal with these different types of anxiety disorders. There are several different ways to cope with anxiety disorders. When you start feeling anxious or you're about to face a nerve-wracking situation, remember to take deep breaths. Deep breathing is a form of meditation and can alleviate some of the anxiety you feel. There are many varieties of medication that can be prescribed, but most of the time, medications are paired with a certain kind of therapy. Cognitive behavioral therapy focuses on thoughts and behaviors the thoughts and behaviors that a person has so that you can identify and challenge the negative thinking patterns and irrational beliefs that fuel the anxiety, according to the helpguide.org. Exposure therapy is another type of therapy that pushes the patient to confront whatever fear they have in a safe and controlled environment. This type of therapy is usually done with phobias, obsessive compulsive disorder, and social anxiety. The therapy is done through repeated sessions and will gradually diminish the anxiety that person feels about a certain situation or object. Because anxiety disorders are becoming more and more common, it is important for people to be informed. Anxiety can be pretty terrifying if you don't understand what it is or how to treat it. As Peter Norton stated in his book named The Anti-Anxiety Workbook, anxiety disorders have success rates that make other researchers jealous. The key is to get the right treatment and stick with it. Anxiety is not the end of the world. All you need is a little bit of help and a schedule to follow.